A pancreatic cyst is a collection of fluid that commonly develops in the pancreas. Most cysts do not cause symptoms, and quite frequently they are discovered while performing tests for other reasons. Some pancreatic cysts are benign or non-cancerous and can develop from inflammation associated with pancreatitis or abdominal trauma. However, some cysts can be considered precancerous and have the potential to develop into cancer. Now let's look at the different types of cysts. The most common types of benign or non-cancerous pancreatic cysts are the following. First, we have pancreatic pseudocysts. These consist of a collection of fluid in or next to the pancreas and most often are the result of pancreatitis or trauma. Then we have serous cystadenomas. These cysts have numerous small pockets of thin, clear fluid and are often asymptomatic. They most commonly are seen in females older than 60. Unlike the thin, clear fluid of serous cystadenomas, precancerous cysts are often lined by cells that produce a thick, mucus-like substance called mucin. These types of cysts have the potential to become malignant or cancerous and include the following. Intraductal papillary mucinous neoplasms, or IPMN for short. These are the most common types of precancerous tumors that start within the cells of the pancreatic ducts. They produce mucin, or thick fluid, that can form pancreatic cysts, or expansion of the duct. Cysts that involve the main pancreatic duct are more likely to progress into cancer and are often surgically removed. However, those that involve only the side branches of the duct rarely develop into cancer, and so they are usually monitored. Next, we have mucinous cystic neoplasms, or MCNs for short. These cysts present as large compartments of fluid in the pancreas, often occurring in women. While these cysts do not involve the pancreatic duct, similar to IPMNs, the cells that line the cyst produce a thick, mucin-like substance that have the potential to become malignant. Depending on the type of cyst, you may or may not be at a higher risk for developing pancreatic cancer. If your pancreatic cyst does not cause symptoms, contains benign cells, and does not present concerning features on imaging tests, it probably will not have to be removed. Again, these types of cysts include serous cystadenomas and pseudocysts. While no medical treatment is necessary for these cysts, your doctor may choose to monitor them. For those cysts that are mucin-producing and considered precancerous, including the intraductal papillary mucinous neoplasms, or IPMNs, and mucinous cystic neoplasms, or MCNs, surgical removal may be recommended if you have symptoms and/or an associated tumor is seen on imaging. Otherwise, these cysts will be monitored with radiologic and/or endoscopic ultrasound imaging to make sure they do not develop features concerning for cancer. If you find out that you have a pancreatic cyst, remember that it does not mean that you will develop pancreatic cancer. However, since some of the cysts can be precancerous, discussing the appropriate next steps for you with your physician is important. You can contact your physician to inquire about pancreatic cancer screening and discuss whether a referral to a specialist or genetic counselor is appropriate.